I think the best way to describe the spiritual care strategy is in terms of past, present and future. Past is the acknowledgement of how the spiritual care department has been shaped by our predecessors and the hospital community, and the value that they place on spiritual care. The present takes into account the fact that over a period of time there's been intensive pastoral care due to the pandemic, and now that we're in a place of recovery, we're asking ourselves, well, you know, what does a spiritual care service look like now? So part of that question is easily answered because we already have spiritual care standards. We also have NHS Scotland who articulates what spiritual care looks like. We set about undertaking an audit, and doing that audit has led to this part where we're delivering the spiritual care strategy over the next 3 years. So our strategy has 4 focus areas. One area is where we're looking to increase the visibility of spiritual care within the organisation, also supporting people who have experienced loss, grief and bereavement. And we also want to support an informed workforce and the continued care planning of spiritual care as part of the holistic nature of healthcare. And the fourth area is that we want to continue to develop and deliver education and training that's specific to spiritual care and well-being and reflective practice. For example, engaging in spiritual care assessments, understanding spirituality and religion within the context of health and social care, and values-based reflective practice, self-care and resilience to attend to the well-being of our workforce.
Our engagement with new patients is up 44% in last year, and the number of patients who have asked for a return visit is up over 120%. What we offer is a supportive listening ear that has the person and their values and what matters to them, not us, at the heart of everything that we're about. To support that, we've updated our webpage so that even in advance of admission, patients can ask for spiritual care support before they come into hospital, and we're already finding that referrals are being made through that pathway. Our posters all have a QR code, again which links directly to our webpage, and this year we have completely revised and updated the booklet that we provide for patients and their families about all that spiritual care can offer. As you know, the spiritual care centres open all day and night, and from the comments that people leave, it seems to be the case that the relaxing and reflective atmosphere of the spiritual care centre is really appreciated and valued by those who use it. At the same time this year we have been, as you can imagine, offering one-to-one support to staff, and again the numbers of staff taking advantage of that support is up 54% on last year. We also offer group reflective sessions such as mindfulness and meditation and breathing exercises. While we've been working on the audit and working on the spiritual care plan, at the same time we've not stood still. We've kept on progressing. We've kept on encouraging more and more staff and patients and their families to recognise that spiritual care really is for anyone and everyone.